Going on with our program, it is my pleasure to welcome back to stage Dr. Anahy Fonseca, that came all the way from Brazil to share her expertise with us. Um, as we get ready for that, and as she comes to join us here on stage, once again, don't forget to prepare your questions, right? So send the questions, put on the papers, go online if you are online. And Dr. Anahy is going to be talking to us now about integrating spirituality and healthcare. With you, Dr. Fonseca.
So I think this is okay, the sound. I think I should put then my spiritual glasses. We are learning with each other, right? So, and let's see if I got it right. So it was a beautiful presentation from MA USA. And let's talk a little bit more about that. Let's see. Okay. But my spiritual glasses, it's too far away, so I'll have to turn. So we've talked a lot today about Joanna de Angelis and the spiritual path to mental health. And I'll bring to you now a little bit of in the medical field, okay? That how we research that in the past 30, 40 years. I saw Alexander there. He's one of the main Brazilian psychiatrists that are studying and researching about spirituality and religion and mental health. I myself are part of the special interest group in the Brazilian Psychiatry Association and also in the World Psychiatry Association. So it's interesting for us to notice some concepts. You see here, health, and it's all the concept of health and mental health. Okay, it's from the World Health Association. So from 1998, the World Health Association already states that mental health is a dynamic state of complete physical, mental, spiritual, and social well-being, and not merely the absence of disease or infirmity. So spirituality appears in the concept from 1998 on. And mental health that we have been discussing today. So the state of well-being in which the individual realizes his or her capabilities, can cope with the normal stresses of life productively and fruitfully, and contribute to the community in which he or she lives. This is from 2001 on, okay? So the state of well-being. So we are talking about well-being. And pathos, as pathological, that we talk a lot here in the West. So it comes from the Greek word, I can't pronounce it. I don't know if any one of you knows Greek, but that it means suffering or experience. A Greek word that means passivity, suffering, feeling, or illness. And it was Descartes that connected it with the suffering thing. So when we are saying, what's your pathology, not your diagnosis, right? So we're pathologizing, right? The suffering. And as we have been talking here previously, so suffering is something that we are all going to go through at some point, especially because the ego is trying to adapt. And here we live, now we can say, one of the crises of humanity to evolve. But people, Jung says that without crisis, there is no development of consciousness, without some sort of crisis. And Josara was talking to us now in the beginning of the day remembering that in Jung's house there was the cross, and about the archetype, we couldn't talk much about the archetype, so ancient forms in our psyche that already have these images that our suffering here, right? But it's a suffering not without a sense or a purpose. It is a suffering to evolve, to development, to develop consciousness. Okay, this is very important. So when Descartes connected pathos, that means also suffering, not only illness and feeling, you see here, and passivity, but it's not a passivity that we can't do anything about it. It's a passivity in terms of acceptance, in psychological terms. So there's many more meanings to pathos than only illness. And we have from Descartes' own associated, and we say medical field, pathology, right? So, okay, so you know that pathos is not only about illness. That's why I wanted to bring the etiology of the word. So, and what about healing? The process of becoming well again, especially after a cut or other injury. This is in the dictionary. Or of making someone well again, like we do in the Spiritist centers, talking to people. The process in which a bad situation or painful emotion ends or improves. It's another way to see it. And what about wholeness, that we talk about holistic concepts, right? Even in medical field, we're talking about that. So the state of forming a complete and harmonious whole, unity, the state of being unbroken or undamaged. So we work pretty much in these days in medical field, the state of being unbroken or undamaged. But I wanted you to bring the dictionary meanings, because it's the first one is the state of forming a complete and harmonious whole and unity. So we are talking about, when we talk about wholeness from the point of view of psychology, we are talking about what we were discussing in the morning. That is the interconnection of everything within us and outside of us. And this interconnection, this perception of the interconnection among everything that is here in this universe, in this time and place, this is spirituality. This is integration. This is growth, evolution, right? So that's why I also wanted to bring you this concept. So I love this guy, Andrew Powell. He has The Ways of the Soul is the name of his book. He's a psychiatrist from England, from the Royal College of Psychiatrists. And he's one of the psychiatrists that founded the first special interest group in psychiatry, spirituality, religion, and psychiatry in the world. It started in England in the Royal College of Psychiatry. You can check and see the special interest group. And Andrew Powell says in his book, despite strong research, I brought some for you, strong research evidence that spirituality and health are positively correlated. Spirituality, this is in the research from the last decades, spirituality has been considered within conventional medicine as irrelevant to the work of the healthcare team. This also occurs in psychiatry because religious and spiritual themes, since Freud, began to be identified with illnesses and seen through the lens of pathology. Okay, this is very important. So initiatives as Dr. Marlene Nobre, that you all know from Brazil, they're a very good friend of Chico Xavier. She developed her mediumship with Chico, and she created the Brazilian Medical Spiritist Association, the first one, AMI Brazil. And then from now on, the International Medical Spiritist Medical Association, and from now on, then a lot of us started, wow, there's something here. So let's study about that. So that's why the movie here that you passed before my talk is so important for us. This initiative is so important. And we say in the medical field that medicine is changing, not exactly because of the doctors. I'm sorry about my colleagues, but that's what's going on. It's changing because of the patients. It's changing because each one of you, when you go and and talk to your daughter, to your doctors, and tell them about your spiritual experiences, and tell them about your dreams, about your religiosity, about your spirituality, you are all helping the medical field develop. There's a research that say, international one, that 70% of the patients want the doctor, their personal doctor, to talk about them about religious and spirituality. And only 30% of the doctors feel okay to talk with the patients about that. So we need very much the patients coming forward and telling their doctors, well, I would like to talk about my beliefs and faiths. I think this helps with my health, because this helps medicine also, okay? So in the previous movie, you saw Dr. Harold Canning. He has been in Brazil also. We are all friends, and you watch each other's research and things like that. And Duke University Medical Center is one of the greatest centers here in U.S. That research spirituality, religion, and health. Okay, and Dr. Kenning has made a review, a systematic review from 1872 to 2010 of all quantitative research published in peer-reviewed academic journals in the English language, listed in the main database, okay? This is a beautiful research and work that he and his team have done. And he has published the first handbook of religion and health, Oxford University Press in 2001, and the second in 2012. And it's a brief summary, so I won't tire you. But religiosity and spirituality, they say in his handbook, it can be a powerful coping resource, as we have been discussing here. It is related to better mental health and healthier behaviors. It is related to better physical health, better medical health, medical and surgical outcomes, and greater longevity. And all, you know, that for researchers' purpose, we have to duplicate, we have to be able to duplicate the research. And they are showing the same results, okay? So I just wanted to bring you this concept so that you can talk in the scientific field, we can talk with academics, you can talk to whoever you want, because we have our own for instance, in Spiritism, our own definitions. And we were talking about Joanna de Angelis and her work and psychology, but for research purposes and in academia. So we separate religion and spirituality. And religion, it's an organized, like Canning and his team started, and now all of us use. So religion is an organized system of beliefs, practices, rituals, and symbols designed to assist the individual's proximity to the sacred and or transcendent. And spirituality in the medical field is viewed as personal research for answers about the meaning of life and the relationship with the sacred or transcendent. Okay? And so Koenig says that spirituality is a popular expression currently preferred over religion, because we say that many people have and call themselves a spiritual person, but not a religious one. So I know that all of you know that. And it is considered personal, defined by the individual. It is generally free from rules and responsibilities associated with religion. A person can be spiritual but not religious. It is seen as common to everyone. It is especially useful in a clinical setting. However, because it is very subjective, it is difficult to measure and quantify. Because, as I told you previously, it's medicine based on evidence. So we need to do research in medicine. And we need to quantify, to have variables that we can compare. So they say that spirituality is we can measure, let's say, and have some instruments in the medical field to measure, like in asking people questions. But in evaluating, actually, the spirituality of a person, if it's more developed or whatever. But it is difficult to, as a variable in research, to compare, okay, as use as a variable. So we use much more religion, for instance, church or temple attendance. I'm quite sure you know that. And it's said that, for instance, if a person go, let's say, to the Spiritist center or church or whatever, but from the person's religion, and practice like once or twice a week, it has the evidence are very strong that the person is more, it's healthier. The person is healthier. And if the person gets sick, for instance, the person recovers quicker. Okay, so these are kind of evidence that the research are showing. And what about religiosity? So it is the extent to which an individual believes, follows, and practices a religion. It can be organizational, participation in church or religious temple, or non-organizational, praying, reading books, watching religious programs, and so on, or both of them. But I wanted to bring you that because there is a difference. When we say, and I'm quite sure that all of you, even in Spiritism, have sometimes difficulty explaining to people that are not Spiritists, oh, but you are Christians, right? So you are kind of fanatic or something like that, right? I know from your smile. So that people don't know this difference between intrinsic religion and extrinsic, okay? So we separate to study how religion affects the person and also the outcome of diseases. And intrinsic religion has a central place in the individual's life. I can tell you that Spiritists usually have intrinsic religion, okay? It is the greatest good. Other needs are seen as secondary, of lesser importance, and as far as possible are placed in harmony with their religious belief and orientation. Having accepted a religion, the individual seeks to internalize, this is a psychological term, internalize it and follow it fully. This variable, religiosity, so intrinsic religiosity, is associated in researches with positive outcomes in clinical studies. This is the religiosity that we see in Spiritism. But fanaticism, extrinsic religiosity, okay? It is a means used to obtain other ends, such as consolation, sociability, this is okay, distraction, but status, this is not okay in psychological terms, and not okay distraction too. So religion is accepted superficially or is adapted to meet the individual's needs and personal goals. This would be very Freudian. That was what was Freudian talking about. Okay, when he called religiosity actually one of the mechanisms of defense of the ego, reactive formation. You know that some of you that are studying Joana de Angelis, she talks about the mechanism of defense. One of them, reactive formation. So this would be extrinsic religiosity adapted to meet the individual's needs and personal goals in a sense of his persona and the likes in social media. Then here we have fanaticism, okay? And this variable is associated with negative health outcomes. So if I believe that God is punishing me, if I believe that my disease, my illness is a punishment from God, if I feel guilty about, then we will have negative health outcomes, okay? And even mortality, the rates of mortality increase. Well, then, that's very important that religious spiritual coping, as we call in the medical field and in psychiatry, is the way that people use their religiosity and spirituality to deal with stressful situations and difficulties in their lives. So today we have been talking about religious spiritual coping from the point of view of the medical field, okay? But as you see, negative religious spiritual coping, we were talking about positive religious spiritual coping, that it's what Joana de Angelis' teachings and the Spiritist knowledge tell us about. But there is also negative religious spiritual coping. In empirical studies, they have been linked, these forms of coping, with depression and anxiety and increased risk of death. As I was telling you, this is from Canning's handbook. Why, people? Because it's extrinsic religiosity, okay? And then it makes a negative religious spiritual coping because I will believe I'm not thinking about my spirituality. I'm not developing it inside of me. I'm not thinking about the concepts. I'm thinking to please whatever religious leader in my community. I think that I'm thinking about, and I'm going to the temple, the center, or the church because I want people to like me, but I don't even pay attention of the sacredness of the text. I don't reflect upon them. And then when I get ill, then I will think that God is punishing me. I will think that it's something really bad that I did. I have no hope. Well, we have an increased risk of death, of course. It's everything connected. So the religious and spiritual dimensions of the culture are among the most important factors that structure the human experience and patterns of health, illness, and death. And for most people, religion and spirituality are more of a source of support and well-being than a psychopathological manifestation. This is very, very important. And negative views of religion and spirituality do not hold up in light of recent studies, which found no independent association between spirituality and psychopathology, as medical personnel thought in the past, and still many of them think in the present. That's why we need the researchers and we need, to talk about that. So why should the clinician address the patient's spirituality? Because beliefs can help patients deal with aspects of their life. Religious activity and beliefs are related to better health and quality of life. Studies show that most patients would like their doctors, as I was telling you, to talk about their religion and spirituality, and reported that they would feel more empathy and trust in the doctor who questioned this topic. An integral and more humanized vision that we are unfortunately losing in many countries in the medical field. This is Ken Parkman from 2012. He has been in Brazil in the first global meeting of spirituality, religion, and mental health that Alexander and I did we were able to put together in one Brazilian Association Psychiatric Congress. So religion and spirituality, they reinforce understanding by offering hope, value, meaning, and purpose. They facilitate integration and social support by linking religious patients with specific forms of community care. They provide systems of meaning and existential coherence. This is very, very important for mental health, as we have been talking. Other possible explanations of how religion can affect health: respect for the body, advocated by many religions, including our friend Dan was talking about Spiritist, generating better nutrition and lifestyle habits, optimization of psychoneuroimmunological, psychoneuroendocrine, and psychophysiological pathways. I just put it here for you to know that even in our body, physiology of our body, we are seeing the effects of a developed spirituality and religiosity in a patient. Better coping and stress reduction strategy, better psychological state by bringing hope, forgiveness, altruism, and love. And approaching religiosity and spirituality, and I think this can be useful, but spiritists usually know that already by all of Kardec's and all the great spirits' writings, in a natural and peaceful way. How does the patient, so questions how does the patient live with the disease? What is the meaning of the disease in his or her life? What cultural beliefs may impact his or her treatment? And use suitable instruments if you are in the medical field. There are a lot of instruments, questionnaires. I wanted to bring you here, guys, because about this wonderful project at Harvard Medical School that is integrating knowledge across disciplines. The name is the Human Flourishing Program, okay? It's a beautiful program that aims to bring together various academic disciplines across the university together on important questions. So it's interdisciplinary program. And I'm not going to go through all this, but I do think you should all Google it, okay? And take a look, because it's a beautiful program. Some of Brazilians researchers have already been there. I just don't want to go too much on that. But the thing is that the program is oriented around the question, how may religion and spirituality in concert with public health and the practice of medicine alleviate illness and promote human well-being? I think they need Joana de Angelis there. What do you think? Right? We'll get there, I'm quite sure. So I brought a little bit of Carl Gustav Jung. This is Jung, okay? Today's psychological problem is a spiritual problem. And Jung was saying this in the 1950s, 1960s. A religious problem. Man is hungry and thirsty for a secure relationship with the psychic forces within himself. So pathways, spiritual pathways to mental balance, right? Authentic religiosity, is the best medicine for all psychological suffering. For psychoneurosis, ultimately, is the suffering of a soul that has not found its meaning. I love this sentence. I love it. I wanted to bring to you because I think this is a summary of what we have been talking today. Okay? And I brought this sentence by Leonard Boff. In Brazil, he's one of the guys, the religious people, that translated Jung to Portuguese. And Leonardo both said the rescue of the spiritual dimension is urgent. We need to rescue spirituality, that is non-material values, the feeling of belonging, see them we were talking about, to something greater, and the perception that things are connected to each other, and that this guiding thread that unites everything in the cosmos is the name that religions gave to that mystery that we call God, which is not outside of us, but within us in our depth. I think it's a beautiful sentence. And then we have Allan Kardec that we have talked a lot, but I wanted very much to bring you this. If the feeling of the existence of a supreme being were nothing more than the product of a teaching, it would not be universal, and it would not exist like the notions of science, except in those who could have received this teaching. So that's a beautiful sentence by Allan Kardec. And I brought you some comics, right? So we can have some fun with ourselves and our difficulty. God, where are you? Well, I'm up here. And also this comic that I love, I think young and teenagers and young medical personnel are reading a lot, the Heart and the Brain. I'm going to bed, wake me when the world is fixed, the heart says. And the brain says, sorry, heart, the world needs you. So thank you. And before I go, I have 4 minutes, so I left some minutes. That's why I'm rushing here to read to you. I made a summary because it's a beautiful prayer by John Henry Newman from the 19th century. So we were talking about darkness. My colleagues previously were talking about also the crisis. And I wanted very much to, I love this prayer. It's just a summary. So lead kindly light amid the encircling gloom. Let thou me on. The night is dark and I'm far away from home. Let thou me on. So long thy power has blessed me, sure it still will lead me on. Until the night is gone, and with the morning those angels' faces smile, which I have loved long since and lost a while. Thank you.